Welcome to our Ask the Expert series for adults living with hydrocephalus and normal pressure hydrocephalus. Joining me today are Dr. Abe Mogakar, a neurologist, and Dr. Mark Luciano, a neurosurgeon at Johns Hopkins Cerebral Fluid Center for CSF Disorders, and my coworker, Jennifer Bouchard, the Hydrocephalus Association's education manager. One of the things that I think is fantastic for our patient population is that with the introduction of the shunt to manage hydrocephalus, we're seeing so many children aging into adulthood now, which of course is wonderful. So that also poses its challenges because now we are looking at how to transition successfully from pediatric care into the adult care, medical care world, and it is a really different world. And I think that there's some culture shock that happens for not only our patients with the condition, but I would actually laugh, in some ways it's harder for the parents to transition to adult care for many reasons. So I'd like to talk a little bit about transition in this segment and a couple aspects of transition. So transition takes place when you turn 18 years old. You become a legal adult in the United States of America, and you are in some ways responsible really for everything, but to varying degrees. You can transition that responsibility over, but really in the eyes of the law, you are an adult in the United States, except for being able to drink. And that includes managing your medical care and your medical record. So let's talk a little bit about young adults who are transitioning into adult care. And we see it, some of them are going to go to college, so they're going to need to find new doctors. Some of them are going to maybe stay in their hometowns, but their doctors, whether it's a primary care doctor or it's a neurosurgeon, are no longer able to see them because there are age limitations to who they can see, and so they need to transition into the adult care world. And of course, transition has many facets to it. So let's talk about the first thing with transitioning, and that is finding what a lot of people refer to as a medical home. What does that medical team look like for an adult now? And how is that different than what kids had as when they had their parents and they were seeing pediatricians and pediatric neurosurgeons and pediatric neurologists? And I'll let Dr. Luciano answer first.
Well, that new medical home may be a little bit more difficult to find, and it may be a bit more dispersed. Pediatric neurosurgeons, of course, are an expert in the area of hydrocephalus and shunting, and they're also expert in that patient because they've dealt with that patient for many years, know the history and the complications, and that's something that's pretty precious. The entire pediatric area of care is different often than the adult, the same area of care, whether it's neurosurgery or another field in the adult world. So there's a lot of different issues with transitioning from the pediatric neurosurgeon, for example, to the neurosurgeon. In particular, children that have grown up with hydrocephalus have very complicated histories. And so these complicated histories are something which, again, the pediatric neurosurgeon may have lived with and understand, is very difficult for an adult neurosurgeon, general neurosurgeon, to really understand quickly. And there are a limited number of adult neurosurgeons that are able to, either by their experience or have as an area of specialty, these complex patients. So the first difficulty is finding the neurosurgeon, but also finding other specialists who deal with other problems. For example, spasticity, there's skeletal issues, there's other issues of children who've grown up with hydrocephalus or other issues. Finding all these specialists to deal with the pediatric complexities is not easy. What we recommend is to start the process before it's really needed. In other words, reach out to adult specialists or adult neurosurgeons that do see complex hydrocephalus patients. That can probably only be started by talking to your own pediatric neurosurgeon, the people that have been treating you. Some people have a pediatric neurosurgeon that can treat well up into an adult age. I was in a situation where I could see patients of any age through the pediatric and adult system to see these patients as they get older at any age. But that's not the case for most the pediatric neurosurgeons. So finding that network of help is critical. It has to start with the people you have as a pediatric neurosurgery patient and having them help you find that group. And then doing it over time, giving the other specialists, the adult specialists, time to know your record and seeing them at baseline and so forth is important to do before an emergency occurs.
So I think it's interesting when we're talking about defining a medical home. Like, I know for when my daughter was young, and my daughter has hydrocephalus, our pediatric neurosurgeon, I pretty much consider that our primary doctor. Oh, she has the flu, I'm going to call our neurosurgeon. I'm being a little, joking in that, but not really. I mean, really, our world revolved around our pediatric neurosurgeon. And so now that my daughter has turned 18, we've had to completely adjust our mindset around the type of doctors that we interact with and how frequently. So that medical home, Dr. Mogakar, could now be a neurologist, for example, is a primary person, or an internist, or a family practitioner. And can you talk about the role that, finding that doctor as that central point? And we will get back to talking about the relationship between a patient and an adult neurosurgeon and how that differs from a patient and a pediatric neurosurgeon. But can you talk about that primary doctor now and how you really can go about finding that and what role they really play in your life?
Yeah, some of the issues related to transition are unique to hydrocephalus, and some of them are more general that are applicable across many pediatric disorders. There are many more services available for pediatric patients in terms of social services, educational help, and one of the things that happens during the transition is all these extra resources disappear. And so it can often come as a shock to the parents and patients that there are no supportive resources available for them, and they have to advocate for everything themselves and seek out these things. Pediatricians are also generally comfortable with hydrocephalus, whereas many adult general practitioners or internists, even neurologists, are not used to seeing these patients in general. So their comfort level is not that great, and there may be some resistance in taking these patients on in the first place. So often it's a challenge to find a good internist or a good neurologist to take your case on and coordinate all the different care pathways that this patient is going to need. So often it's asking your pediatrician, just like you would ask your pediatric neurosurgeon, is going back and asking your pediatrician, who would be the right person for me to continue my child's care with. And again, it is a process. It can take a lot of time, and often it's as difficult to find a good internist as it is to find a good adult neurosurgeon.
And I know that part of that we like to talk to parents about is it's really important to help. You really should start transition almost at the age of 12, right? Because what you're doing with your child at the age of 12 is starting to get them comfortable about speaking about their condition. And taking on more of that advocating for themselves as time goes on in the medical appointments, so that by the time they hit 18, if they, and they are going to be spoken to as the primary person in the medical appointment, they're able to actively participate, ask the questions that they need to ask in the medical appointments, feel comfortable talking about their medical condition. But there's a piece of that happens with the doctors too. And so that you're, being able to work with your pediatric doctor and taking on more of the lead in those appointments as you become an older teenager, so that your doctor is helping you prep for transitioning to care. And then there's also a lot of documents that doctors will provide patients, and the Hydrocephalus Association is also developing resources around this where you can fill them out. And it's not, your medical record is easy, that can go with you, but these are more details around you, more personal to you, maybe your personality, some of the challenges that you face, emotionally even sometimes, as well as questions that are unique to your medical condition. So when you're in shunt failure, how does hydrocephalus look for you? That are documents that you can work on with your pediatric doctors, so that when you transition to your adult doctors, they have this nice set of information about you that helps them get to know you. Legally, though, there are some patients that aren't necessarily ready to not have their parents be there actively listening, helping them take in all the information and helping them make decisions. What does a patient need to do to prepare for that transition? Because it happens abruptly at 18. At 18, all of a sudden, you're thrust into this new world.
Yeah, and there's a big spectrum. There are some patients with hydrocephalus, with shunts, who are perfectly capable of making medical decisions by themselves, and they should continue to do so. Whereas there are some patients who are going to need the help and advice of their parents and want it and have them involved in their care going forward. And in that case, it's important to get a power of attorney document made so that they can legally be involved in your care. And because hospitals have very strict rules as to whom they will communicate and will not communicate in the presence or absence of these documents. So it's better to have them prepared ahead of time before you think you're going to need them.
So a medical power of attorney, and I also believe that some doctors' offices and or hospitals, medical hospital, universities and hospitals will have their own set of documents that you can also sign that give somebody permission to receive information and talk to doctors.
And that's especially important for these new electronic health record systems, where you may have to give explicit permission to have your parents log in representing you, so that you can get results of all your scans, all the reports, all the consultations that you've had. So it's important to get that document signed and sent to your physician.
So let's talk about the emotional piece of transitioning, Dr. Luciano, because you find your new doctors, you find your care team, you feel comfortable, you get your papers over which describe who you are and how amazing you are, and your medical history, and all of that gets transferred over successfully to this new group of people who are going to care for you, whether you're in college finding a new group of doctors, or sticking in your hometown but transitioning to a new group of doctors, or even moving across the country for a job. But the bottom line is, the world of adult neurosurgery is different culturally than the world of pediatric neurosurgery. In a different segment, we talked about how you don't necessarily see patients who are doing well once a year. And I think in the pediatric world, we're so used to check-ins continually with our pediatric neurosurgeons. So can you talk about what an adult patient should now expect in their relationship with their neurosurgeon?
Start by saying that I'm trained as a pediatric neurosurgeon and have been treating kids for decades, really. So I've been steeped in the pediatric culture, which I think is wonderful and I love. And I realize as I treat more adults that just how different that culture really is. And it's not because adult neurosurgeons are meaner or less sensitive or less good as physicians. Not that at all. It's really that they see a whole different set of neurological problems and issues, and also aren't accustomed to dealing with the other nuances of a person and their relationships with families and so forth, that pediatric caregivers in general and pediatric neurosurgeons are quite used to. So they're not used to those sorts of issues or relations.
They're not used to the pushy hydro mom who
no.
in the appointment, okay, so.
That's right. I mean, on occasion we have elderly patients who have pushy children, but for the most part we're dealing with the patient, so that the culture is different in that sense. And so as much as I would love to see patients who are doing well every year, it turns out with all the other pressures of an adult neurosurgeon and luckily the volume of patients who are doing well and have grown out of childhood into adulthood with hydrocephalus and shunting, that there are more often only time to treat patients who are having a problem. Also, as a child, there may be really subtle changes that you may want to find in a developing child much more quickly that they can't report. With an adult, most adult physicians and neurosurgeons pretty much depend on the patient to report to them that there's an issue or problem. And that's the culture, and that's the more of the habit of the adult physician and a neurosurgeon as well. So the culture of come to me with a problem and I'll deal with that problem is much more prevalent in adult care, generally speaking. As you mentioned, it's not just a neurosurgical part. So we tell our patients that we're happy to see you anytime or hear from you anytime you have a concern that you might have a neurosurgical problem, and we'll have you come into our clinic. But we don't make any regular visits as has been accustomed in pediatrics. We also do tend to focus more in on the neurosurgical problem as we can. Part of what we have to do in transitional and adult is to try and have a network of other specialists that can help support the patient in other ways.
Great. And so, Dr. Mogekar, I know that you actually play a big role at Johns Hopkins with Dr. Luciano managing care, that's not necessarily the care paradigm in other hospitals. But what special role do you feel a neurologist can play in the world of an adult living with hydrocephalus?
So neurologists are useful in many different ways. Many patients with hydrocephalus have headaches, and often neurologists are well trained to manage them. The older population, like normal pressure hydrocephalus patients, have other cognitive problems associated with it, and so they are better trained to deal with those aspects. So I understand neurologists may not be available everywhere where patients may be. It's more important to, again, have a good internist who's willing to coordinate care amongst all your specialists and knows you well and understands you better and has followed you through time, so that they get a sense of when things are going right and when things are not going right, to make the right decisions.
And so, Jen, you are one of the instances where you're actually still seeing your pediatric neurosurgeon. They are allowed to continue seeing you. Can you talk a little bit about how transition was different for you? Because there are people who are watching us today who won't have to transition from pediatric neurosurgery to adult neurosurgery, at least not right away necessarily. But I know that you've done some transition work in other areas of your medical life. So.
Yeah, so again, as Amanda mentioned, I still see my pediatric neurosurgeon, but I've always had an internist who is overseeing all of my care. And so I slowly started to transition to an adult neurologist, and I had GI issues, so an adult GI specialist and other specialists like that. And so it's really, I've just focused on seeing the internist when needed, and she's kind of communicating with everybody else and keeping everyone in check with what's going on. And she's monitoring my long-term health. You have hydrocephalus, what else might we be looking for? Or you have these GI issues, what else might we be looking for down the line?
So I'm going to end this segment by asking each of you to give your number one must tip to our audience watching today. And that is, what do you think a patient must do, and a family, to have a successful transition into adult care? What's the top thing?
To plan the transition and have your pediatric team help you reach out to plan this transition before it's really needed into the adult world.
Teach your child at a young age to speak up at appointments. I think that's very important. I was taught, at the age of 12, I had to start looking the doctor in the eye and telling them about my symptoms and things like that. So I think slowly guiding your child in that direction is very important.
I would recommend collecting all your operative records. Often these things go into long-term storage after 5 or 6 years, and it can be a huge challenge. And you don't want to be needing emergency surgery or not have access to your really old records. So start getting those old records out of long-term storage and imaging where possible. Try and get them on a disk, make multiple copies of them, and carry one copy with you.
And my advice, I think, would be for parents actually, to make sure that you understand legally what happens when your child turns 18, and that things are in place so that there are no barriers if you and your child have decided that you want to be able to continue with a relationship that you currently have, so that you are prepared early enough and you have the legal documents in place to allow you to continue to be a part of the medical care if that's what your child chooses. And so the second piece of that would be sit down and have a really candid talk with your child about what they want as they transition into adulthood. I think sometimes often as parents we feel like maybe our kids need us more than they do or they feel they need us, and sometimes it's important to let them try on their own and make some decisions and learn that way as well. So that would be my number one tip. I had some wonderful conversations with my daughter prior to her 18th birthday where she was very honest about what she wanted and needed from me as we transitioned, and as well as what she needed and wanted from her doctors. So that was really wonderful. The Hydrocephalus Association is taking on transition. We are putting together resources for our families that are transitioning. It's an exciting project for us to not only help our young adults with the transitioning process, but to also help educate doctors around what they need in order to be ready to receive these patients. So always check back on our website. We'll be continually adding over the years new resources for both medical practitioners and patients and their families. And just to close, I would say the world of adult care is different than the world of pediatric care. And even adult hydrocephalus in and of itself can be very different than pediatric hydrocephalus. New challenges might arise. We have other segments that you can go and watch where we've talked about headaches, and we've talked about slit ventricles. All of these are things we see in the adult populations, depression and anxiety. So as you age with your hydrocephalus, understand your hydrocephalus and know about it. Know that we are here to provide you resources, and we look forward to being able to support you along your journey, but make sure that you understand and have great expectations of what that adult medical world looks like. So I want to thank all of you for joining us. I want to thank everyone here this afternoon for speaking on this really important topic as more people age into adult life who are living with hydrocephalus. Thank you to those of you that submitted questions on Facebook and Twitter to really make our Ask the Expert series as robust as it is. And we'll see you next time.